Have you ever woken up in the middle of the night with that throbbing pain in your temples? Or perhaps you've been startled to see the numbers on your blood pressure monitor climbing higher and higher while your doctor shakes their head with concern. I know exactly what it's like to live with that constant fear, checking your blood pressure several times a day, carrying medication everywhere, avoiding joyful moments with family because you're afraid that emotion might make your heart work too hard. Hypertension steals more than our health. It steals our peace, our freedom. And the worst part is hearing those same generic recommendations: cut back on salt, lose weight, take your medications, as if it were that simple, right? After years of helping people like you regain control over their blood pressure, I've discovered that there are solutions your doctors rarely mention, natural, accessible solutions that really work. In today's video, I'm going to share with you which common fruit loved by seniors across America might actually be spiking your blood pressure without you realizing it. Knowledge that has transformed the lives of hundreds of my patients. Imagine being able to gather with your grandchildren without worry, travel without fear of an emergency far from home, or simply wake up without that feeling of heaviness in your chest. This isn't just another empty promise. It's a proven path you can start today with simple foods and habits that are already within your reach. So stay with me until the end, because this could be the most important video you'll watch this year for your cardiovascular health. Before we begin, I'd love to know if you or someone in your family suffers from high blood pressure. Leave a comment below sharing your experience or any questions you have about the topic. And don't forget to subscribe to the channel and turn on notifications to receive more content that can transform your health. When it comes to managing hypertension, most of us focus on reducing sodium intake and increasing consumption of foods rich in potassium and magnesium. We hear about the benefits of bananas, leafy greens, and whole grains. But what if I told you that one of the fruits most commonly recommended for seniors, a fruit that's in nearly every American kitchen, might actually be causing your blood pressure to spike dramatically? This isn't just my opinion. Recent research has shown a concerning correlation that many healthcare providers are simply unaware of or choose to ignore. As a cardiologist who's treated thousands of patients with hypertension over the past 3 decades, I've seen firsthand how eliminating this one fruit from their diet led to significant improvements in their blood pressure readings, often within just 2 weeks. The fruit I'm talking about is grapefruit. Yes, that bitter, juicy citrus that many health experts praise for its vitamin C content and antioxidant properties. Now, don't get me wrong, grapefruit isn't inherently bad for everyone. In fact, for many people, it can be part of a healthy diet. The problem arises specifically for seniors who are taking certain blood pressure medications. You see, grapefruit contains compounds called furanocoumarins that interfere with an enzyme in your intestines called CYP3A4. This enzyme is responsible for metabolizing many medications, including several common blood pressure drugs like calcium channel blockers. When grapefruit inhibits this enzyme, your body can't process these medications properly, leading to higher concentrations in your bloodstream than your doctor intended.
What makes this particularly dangerous is that many seniors are taking multiple medications, often prescribed by different specialists who might not be communicating effectively with each other. Your cardiologist prescribes one medication, your primary care physician another, and perhaps a specialist adds a third to the mix. No one explicitly tells you about this fruit interaction because they assume someone else already has, or they simply forget that this common food could be affecting your medication's effectiveness. I want to make a pause for a moment to ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers from your exam, but how you feel living with this condition day after day. Many people tell me privately how isolated they feel, as if no one really understands the constant burden they carry, that silent fear that accompanies every heartbeat. If you identify with this, I would really like to hear about your experience in the comments below. It could be something simple like, "I've been fighting hypertension for X years, and what afflicts me most is your biggest concern." Sharing your story not only helps me create more relevant content for you, but also shows other people watching that they aren't alone in this battle. Sometimes knowing that someone is going through the same situation already brings immense relief. And who knows, your experience might be exactly what someone needed to read today to find hope. Now, let's continue our conversation about how we can transform this reality together. So, which medications specifically interact with grapefruit? The list is longer than most people realize. Calcium channel blockers like amlodipine, felodipine, nifedipine, and verapamil are commonly prescribed for hypertension and can be affected. Statins like atorvastatin, lovastatin, and simvastatin, which many seniors take for cholesterol management alongside their blood pressure medications, are also impacted. Even some anti-anxiety medications like buspirone and anti-arrhythmic drugs like amiodarone can interact with grapefruit. Just half a grapefruit or one small glass of grapefruit juice can be enough to cause these interactions, and the effects can last up to 72 hours. That means even if you're careful not to consume grapefruit around the time you take your medication, you could still be experiencing interactions from grapefruit you ate 2 days ago. What makes this particularly insidious is that the symptoms of medication interactions often mimic other health concerns common in seniors. You might experience dizziness, fatigue, or headaches and attribute them to age, stress, or simply your hypertension itself, never suspecting that your morning breakfast could be the culprit. I remember one patient, Margaret, who had been struggling with uncontrolled hypertension for years despite taking her medications faithfully. She came to me after her previous doctor had continued to increase her dosage with little improvement. During our consultation, I noticed she mentioned enjoying half a grapefruit every morning as part of her heart-healthy breakfast routine. When I suggested she eliminate grapefruit from her diet for 2 weeks, she was skeptical but willing to try. At her follow-up appointment, her blood pressure had decreased by 15 points systolic and 8 points diastolic. She was astonished that such a simple change could make such a significant difference after years of struggle.
Now, if you're currently consuming grapefruit and taking any medications, please don't panic and don't stop taking your prescriptions. Instead, talk to your healthcare provider about potential interactions. They can help determine if your specific medications are affected and might suggest alternatives that don't interact with grapefruit if you're particularly fond of this fruit. Remember, your pharmacist is also an excellent resource for information about medication interactions, sometimes even more knowledgeable about these specific issues than physicians. Let's talk about some safer alternatives that can help lower your blood pressure naturally. Berries like blueberries, strawberries, and blackberries are excellent choices. They're rich in flavonoids and antioxidants that help reduce inflammation and improve blood vessel function. A study published in the Journal of the Academy of Nutrition and Dietetics found that consuming just 1 cup of blueberries per day for 8 weeks led to significant reductions in blood pressure in postmenopausal women with pre- and stage 1 hypertension. The best part? These berries don't interact with blood pressure medications the way grapefruit does. Another fantastic option is kiwi fruit. Research from Oslo University Hospital found that eating 3 kiwis a day for 8 weeks lowered systolic blood pressure by an average of 3.6 millimeters per Hg in people with mildly elevated blood pressure. Kiwis are rich in potassium, which helps counterbalance the effects of sodium in your diet, and they're also high in vitamin C and lutein, which support overall cardiovascular health. Again, kiwis don't have the enzyme-inhibiting properties that make grapefruit problematic. Bananas are perhaps the most well-known fruit for blood pressure management, and for good reason. A medium-sized banana contains about 422 milligrams of potassium, approximately 12% of your daily recommended intake. Potassium helps your kidneys excrete more sodium through urine, effectively lowering your blood pressure.
But what many people don't realize is that bananas also contain a type of fiber called resistant starch, which feeds beneficial gut bacteria that can influence blood pressure regulation through the gut-heart axis. This emerging area of research suggests that a healthy gut microbiome plays a crucial role in cardiovascular health. Let's not forget about watermelon, which contains an amino acid called L-citrulline that helps produce nitric oxide in the body. Nitric oxide is a powerful vasodilator, meaning it helps relax and widen blood vessels, allowing blood to flow more easily and reducing pressure on artery walls. A study from Florida State University found that watermelon extract supplementation reduced blood pressure in adults with pre-hypertension or stage 1 hypertension. Watermelon is particularly beneficial during summer months when many seniors become more vulnerable to dehydration, which can worsen hypertension. Avocados deserve special mention, especially for seniors who might be taking potassium-sparing diuretics. While many fruits and vegetables high in potassium can potentially cause problems for people on these medications by raising potassium levels too high, avocados offer a unique balance of nutrients. They're rich in monounsaturated fats, which help reduce LDL cholesterol while maintaining HDL, good cholesterol. These healthy fats also promote satiety, which can help with weight management, another important factor in blood pressure control. One study found that overweight adults who ate one avocado daily for 6 months experienced significant improvements in cholesterol levels and overall vascular health.
Now, beyond avoiding grapefruit and incorporating these beneficial fruits, there are several other dietary strategies that can help manage hypertension effectively. The DASH diet, or dietary approaches to stop hypertension, has been extensively studied and proven to lower blood pressure significantly. This eating pattern emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy while limiting foods high in saturated fats and added sugars. What's particularly impressive about the DASH diet is that it can lower blood pressure in as little as 2 weeks, with effects similar to taking a single blood pressure medication. The Mediterranean diet also deserves attention for its powerful blood pressure lowering effects. This eating pattern, characterized by abundant plant foods, olive oil as the primary fat source, moderate consumption of fish, poultry and dairy, and limited red meat, has been associated with a 30% reduction in cardiovascular events in high-risk individuals. What makes the Mediterranean diet particularly valuable for seniors is its emphasis on social eating and enjoying meals with family and friends, which addresses the psychological aspects of health that are often overlooked in hypertension management. Speaking of psychological aspects, let's talk about stress management. Chronic stress contributes significantly to hypertension, especially in seniors who may be dealing with life transitions, loss, or health concerns. When you're stressed, your body produces hormones like cortisol and adrenaline that temporarily boost blood pressure by increasing heart rate and constricting blood vessels. Over time, this stress response can lead to chronic hypertension. Simple stress reduction techniques like deep breathing, progressive muscle relaxation, or mindful walking can have profound effects on blood pressure. One study found that seniors who practice mindfulness meditation for just 10 minutes daily experienced an average reduction of 5 millimeters of Hg in systolic blood pressure after 8 weeks. Sleep quality is another critical factor that many healthcare providers overlook when treating hypertension. During normal sleep, your blood pressure naturally drops by 10 to 20%, a phenomenon known as nocturnal dipping. People who don't experience this nighttime dip, often due to sleep disorders like sleep apnea or insomnia, have a significantly higher risk of cardiovascular events. Improving sleep hygiene by maintaining a consistent sleep schedule, creating a cool, dark sleeping environment, and avoiding screens before bedtime can help restore healthy blood pressure patterns. If you regularly feel tired during the day despite spending adequate time in bed, or if your partner reports that you snore loudly or stop breathing during sleep, talk to your healthcare provider about being evaluated for sleep apnea. Hydration status also plays a crucial role in blood pressure regulation, particularly for seniors who often have a diminished sense of thirst. When you're dehydrated, your blood becomes more concentrated and your body produces a hormone called vasopressin that causes your blood vessels to constrict, raising blood pressure. On the other hand, proper hydration helps maintain blood volume and support kidney function, allowing your body to eliminate excess sodium more efficiently. Aim for about 8 cups, 64 ounces of fluid daily, adjusting based on your activity level, climate, and any specific medical conditions. Water is the best choice, but herbal teas and water-rich fruits and vegetables also contribute to your daily fluid intake. Just be mindful of beverages containing caffeine or alcohol, which can have diuretic effects and potentially raise blood pressure.
Regular physical activity is perhaps the most powerful lifestyle modification for managing hypertension, with effects comparable to medication for many individuals. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous activity per week, plus muscle strengthening activities at least twice weekly. For seniors, activities like walking, swimming, or stationary cycling are excellent options that are gentle on the joints while providing significant cardiovascular benefits. Research shows that regular exercise can lower systolic blood pressure by an average of 5 to 8 millimeters Hg. What's particularly encouraging is that these benefits can be achieved even with short bouts of activity spread throughout the day. If you've been sedentary, start with just 5 to 10 minutes of walking and gradually increase your activity level as your fitness improves. Now, let's address a question I hear frequently from my patients. If I need to avoid grapefruit, what about other citrus fruits? This is an excellent question. While grapefruit is the most potent inhibitor of the CYP3A4 enzyme, some research suggests that Seville oranges, used in marmalade, tangelos, and pomelos may have similar, though less potent effects. Regular sweet oranges, mandarins, and tangerines generally don't cause the same level of concern. However, if you're taking medications that have strong interactions with grapefruit, it might be prudent to discuss all citrus consumption with your healthcare provider. Another common question concerns grapefruit extract or supplements. Unfortunately, these can actually be more problematic than the fruit itself, as they often contain concentrated amounts of the compounds that cause medication interactions. Always check with your healthcare provider before taking any supplements, especially if you're on prescription medications. For those wondering about the time frame, the effects of grapefruit on enzyme activity can last up to 72 hours after consumption. This means that even if you take your medication in the morning and consume grapefruit in the evening, you could still experience an interaction. The best approach for those on affected medications is to avoid grapefruit completely, rather than trying to time your consumption around your medication schedule. I want to emphasize that managing hypertension successfully requires a comprehensive approach. While avoiding grapefruit and incorporating heart-healthy fruits are important steps, they're most effective when combined with other lifestyle modifications and proper medical care. Regular monitoring of your blood pressure at home, taking medications as prescribed, maintaining a healthy weight, limiting alcohol consumption, and avoiding tobacco are all crucial components of a heart-healthy lifestyle. It's also important to work collaboratively with your healthcare team. Bring a list of all medications, supplements, and typical foods you consume to your appointments. Don't be afraid to ask questions about potential interactions or side effects. Remember, you are your own best advocate, and being informed empowers you to make better decisions about your health.
Now let me share a success story that illustrates the power of these comprehensive approaches. Robert, a 72-year-old retired teacher, came to me with persistent high blood pressure despite taking 3 different medications. His systolic pressure consistently hovered around 160 millimeters per Hg, putting him at high risk for stroke and heart attack. During our consultation, I learned that Robert enjoyed grapefruit juice every morning and occasionally took a grapefruit extract supplement that a friend had recommended for cholesterol management. He also admitted to a sedentary lifestyle and poor sleep habits, often staying up late watching television. We developed a plan that included eliminating grapefruit products, implementing a modified Mediterranean diet rich in berries, bananas, and leafy greens, and starting a gentle walking program, beginning with just 10 minutes daily. I also suggested he establish a consistent sleep schedule and practice deep breathing for 5 minutes before bed. When Robert returned 3 months later, his blood pressure had stabilized around 128 by 82 millimeters Hg, allowing us to reduce one of his medications. More importantly, he reported feeling more energetic and less anxious about his health. This transformation didn't happen overnight, but through consistent, sustainable changes that addressed multiple factors contributing to his hypertension. Remember, small changes can lead to significant improvements over time. You don't need to overhaul your entire lifestyle at once. Start by eliminating grapefruit if you're on interacting medications. Then, gradually incorporate more heart-healthy fruits and other lifestyle modifications. Track your blood pressure regularly to see how these changes affect your readings, and share this information with your healthcare provider. If you've made it this far, you probably know how difficult it is to live with uncontrolled blood pressure, that constant worry, the medications with side effects, the restrictions that seem to steal a little joy from everyday life. I want you to know that you are not alone on this journey. Our channel was born exactly from the desire to create a support community for people like you who are seeking natural and effective alternatives to care for cardiovascular health. Each week, we share new discoveries, simple recipes that help control pressure naturally, and answer questions that doctors often don't have time to explain during consultations. If this content made sense to you, consider subscribing to the channel and turning on notifications. This way, we can walk together on this health journey, one step at a time, without rushing, but with the consistency your heart deserves. I don't promise miracles, but I guarantee honest information based on serious research and the experience of those who have already achieved real results. Take good care of yourself, and I hope to see you in the next video, where we'll continue our conversation about how to live better even with hypertension. Your heart appreciates every small care you dedicate it today.